Welcome back to the CBC News Network. Many agencies, including Health Canada and the U.S. Department of Health and Human Services, have the same advice for pregnant women. Don't drink while you're pregnant. But a new Danish study is suggesting that moderate alcohol consumption has no effect on a child's neurodevelopment. So, is having a drink or two while pregnant safe? Let's turn to our Dr. Karl to get some answers. Dr. Karl, this study's findings seem to contradict the conventional wisdom. You took a look at what the researchers had to say. What did they find specifically?
Well, yeah, I'm not sure that I would say they contradict the conventional wisdom, because the advice, even these researchers themselves say the best advice is to not drink at all if you're pregnant. But what they did find, though, is that when they looked at this cohort of women in Denmark, they found that those who drank a small amount, and by their definition that was 1 to 4 drinks per week, or a moderate amount, which was between 5 and 8 drinks per week, they found that those women, when they looked at their children 5 years later, so as 5-year-olds, there was no appreciable sort of neurocognitive deficit, except for women who drank a little bit more than that, so 9 drinks or more in a week. Those children demonstrated some decrease in their ability to pay attention. But other than that, they weren't able to find anything that was statistically significant.
Okay, and how many drinks a week was this? About 5 to 8?
So, yeah, overall what they're saying is between 1 drink and 8 drinks per week, there was nothing that they found.
Okay.
Now, we should be careful here, though, because their definition of a standard drink is different from the one that we use in Canada. So for them, a standard drink contains 12 grams of alcohol, raw, pure alcohol, whereas in Canada, we consider a standard drink to be 13.6% alcohol.
Okay. What could be the health risk for babies if their moms consume too much alcohol while they're in the womb?
Well, we know that there is a syndrome called the fetal alcohol syndrome, where there are actual sort of physical changes that happen to the fetus, and that translates to a child who grows up with, mental disabilities potentially, as well as facial malformations and so on. So we know that. We also know that there can be intellectual deficits, regardless, aside from the fetal alcohol syndrome, there can be intellectual deficits for women who consume a lot of alcohol. But our challenge here is that we don't know where the cutoff is. What is a lot of alcohol? At what threshold do we start to see these problems? And that's what this research is trying to kind of move us closer to an understanding of.
Okay, but there would be no. I just wonder if there would even be a choice here for moms, because, are there no benefits to having a drink while you're pregnant?
Well, that's right. So I think maybe the most useful way to look at this is in reverse. So in general, if you're pregnant, you should not consume any alcohol. But if for some reason, either by accident or for whatever, whatever
you
reason,
fall on a bottle of wine and some of it falls into your mouth, don't panic.
Or you have, you may have a couple of drinks before you know that you're pregnant or what have you. Mm-hmm. The idea here is that it's not the end of the world. It's not, necessarily grounds to terminate the pregnancy because something terrible is going to happen. This is more of a reassurance that a small amount of alcohol probably won't do harm. But we hasten to add, though, that it's best not to consume any alcohol.
All right. CBC medical specialist Dr. Karl Kabasele speaking with me in Toronto. Dr. Karl, thank you once again.
Thank you.